Let me ask you something most men never bring up. Not with their friends, not with their doctor, sometimes not even with themselves. How often are you actually ejaculating these days? If you paused or felt a little uncomfortable, that's exactly why this conversation matters. Because there's a growing body of research suggesting that ejaculation frequency, especially as men get older, is tied to something far bigger than most people realize: prostate health, hormone regulation, even long-term risk of disease. I'm Dr. Emily Carter, and in my years as a urologist, I've had this conversation with hundreds of men over 50, and almost every single time, the reaction is the same: surprise followed by relief, because nobody ever told them this was something worth paying attention to. Today, I want to walk you through what the research actually shows, why frequency tends to quietly decline with age, what that decline may be costing you, and what the studies suggest about a healthy target. This isn't about performance, and it isn't about ego. It's about a part of men's health that gets almost no attention, despite meaningful evidence that it matters. Before we get into it, if this is the kind of honest conversation you don't get anywhere else, hit subscribe and drop a comment letting me know you're here. These topics only get talked about openly if we're willing to talk about them at all. Let's get into it. Here's the part that surprises most of my patients first. Ejaculation frequency declines steadily with age, and it's rarely a conscious decision. It's not that desire disappears overnight. It's a slow drift driven by a mix of factors that stack quietly over the decades. Testosterone naturally declines with age, gradually reducing libido for a lot of men. Relationships change, and for many long-term couples, frequency naturally settles into a different rhythm than in their 20s or 30s. Stress, sleep, and general health all play a role too. And then there's the part nobody says out loud. Many men simply stop prioritizing it, treating it as optional, something that used to matter more, but doesn't anymore. The problem is, several studies suggest that consistent ejaculation may function almost like a form of maintenance for the prostate specifically. Just like your joints benefit from regular movement, or your cardiovascular system benefits from ongoing use. Some research points towards similar mechanisms here. This is the piece that gets almost no mainstream attention. A well-known study following tens of thousands of men over multiple decades found that men who ejaculated more frequently, roughly 21 or more times per month during certain periods of adulthood, had a meaningfully lower risk of developing prostate cancer later in life compared to men with much lower frequency. Now, I want to be careful here because correlation is not the same as proof of direct cause, but the proposed mechanism makes physiological sense. One theory is that regular ejaculation helps clear built-up fluid and potentially carcinogenic compounds from the prostate, rather than allowing them to accumulate. Another is that it may reduce inflammation within prostate tissue over time. Neither mechanism is fully settled science, but the association across large study populations has shown up consistently enough that urologists take it seriously. I always tell my patients, this doesn't mean you need to hit some specific number to protect yourself. It means that treating this as a nice-to-have rather than a legitimate piece of your health routine is probably a mistake. If you've been avoiding it out of habit, low mood, or simply not thinking about it, that's worth reconsidering the same way you'd reconsider skipping exercise for months on end. Beyond the prostate specifically, there's a broader hormonal and psychological piece worth understanding. Ejaculation triggers a release of several hormones, including oxytocin and prolactin, both linked to reduced stress and improved mood. For older men especially, who are statistically at higher risk for chronic stress, social isolation, and mild depressive symptoms, this matters. It's not a cure for any of those things, but it's a legitimate contributing factor to overall well-being that gets almost no attention in conversations about men's mental health. There's also a sleep connection. The hormonal shift that follows ejaculation, particularly the release of prolactin, is associated with improved sleep onset for a lot of men. Given how much I've talked about the importance of deep, quality sleep in men over 60, this is one more thread that ties back into that same picture. Better sleep supports better cardiovascular health, better cognitive function, better mood regulation. It's all connected. I had a patient in his late 60s who came in concerned about persistent low energy and a flat mood he couldn't explain. Nothing showed up in his blood work. As we talked through his lifestyle, it became clear that intimacy of any kind, including on his own, had essentially dropped out of his life over the past several years without him consciously deciding that. He wasn't in a relationship at the time and had simply stopped thinking about it as part of his health. We talked honestly about reintroducing it as a regular part of his routine, and a few months later at a follow-up, he mentioned almost as an aside that his mood had noticeably improved. I can't isolate that single factor as the entire explanation, but it was clearly part of the picture. A fair question I get constantly is whether there's such a thing as too much or a specific number men should be hitting. The honest answer is that the research points toward a general pattern rather than a strict prescription. The studies showing reduced prostate cancer risk used a benchmark of around 21 times per month during certain adult years, but that number reflects population averages in research, not a personal requirement. What matters more than hitting any specific frequency is avoiding long periods of complete absence, particularly as you age. Going from a regular pattern to essentially none for months or years at a stretch is where the research suggests the more meaningful risk differences show up. For men dealing with erectile difficulties, low libido, or other barriers, this is also worth raising directly with your doctor. These are often treatable, and men frequently suffer in silence for years before mentioning it, assuming it's simply an unavoidable part of aging. In many cases, it isn't. Here's what I want you to understand above everything else in this video. Men are comfortable openly discussing cholesterol, blood pressure, even prostate exams. But this specific topic, despite meaningful evidence connecting it to real health outcomes, gets almost no airtime. That silence has a cost. Men quietly deprioritize something that may be protecting them simply because nobody ever framed it as a legitimate health behavior worth maintaining. I bring this up with my older male patients the same way I'd bring up exercise or diet, directly without embarrassment, because avoiding the conversation doesn't serve anyone. If you've been treating this as something that used to matter and doesn't anymore, I'd encourage you to reconsider that framing. The research suggests it's not something you outgrow, it's something that continues to matter, arguably even more as you get older. Here are additional sections to insert before the closing, adding roughly 500 words of new content in the same style. I want to spend a moment on something that gets lost when people talk about this topic in broad strokes. The risk picture actually shifts as you move through different decades, and the research reflects that. In your 50s, the conversation is mostly about maintaining a consistent pattern and not letting years of accumulated stress, medication side effects, or relationship changes quietly erase something that used to be routine. This is the decade where testosterone decline starts becoming more noticeable for a lot of men, not dramatically, but enough that libido can soften without an obvious trigger. It's also frequently the decade where common medications, blood pressure drugs, antidepressants, and others start entering the picture, and several of these carry side effects that reduce libido or function without men necessarily connecting the dots back to the prescription. I always tell my patients in this age range to bring it up directly with whoever manages their prescriptions. There are almost always alternatives, or at least adjustments, but only if the conversation happens. Too many men simply assume the decline is aging and nothing more, when in a meaningful number of cases, it's a side effect that can be addressed. By your 60s and 70s, the picture shifts again. This is where the cumulative research on prostate health becomes more directly relevant, because this is the decade where prostate cancer risk climbs substantially regardless of any other factor. It's also the decade where men are most likely to have quietly gone years without much activity in this area at all, often without any single decision behind it. Just a slow drift compounded by lower energy, reduced opportunity, or simply not thinking about it as something to maintain. What the research consistently shows across these older age brackets is that the men who maintain some regular pattern, even a modest one, tend to track better across several unrelated markers: mood, sleep quality, and reported quality of life among them. Again, I want to be careful about overstating causation here. Healthier men in general may simply be more likely to maintain this kind of routine in the first place, but even accounting for that, researchers have found the pattern holds up enough that it's considered a legitimate factor worth discussing, not just statistical noise. In my years treating this specific area, I've noticed a handful of misunderstandings that come up constantly, and I think it's worth addressing them directly. The first is the assumption that declining frequency is purely physical, a simple matter of aging hormones and nothing else. In reality, a huge portion of what I see in my practice is psychological or circumstantial. Men who've lost a spouse, men going through a difficult stretch at work, men dealing with body image concerns as their physique changes with age, all of these can suppress interest and frequency just as powerfully as any hormonal shift. Treating this purely as a biological issue misses half the picture, and it means a lot of men give up on addressing it because they assume it's an unfixable hormonal reality when it may actually be something far more treatable. The second misunderstanding is thinking that because a partner isn't present or interested, the entire topic becomes irrelevant. This is one of the more damaging assumptions I encounter, because the research on prostate health, hormone regulation, and stress relief doesn't require a partner at all. The mechanisms we've discussed apply regardless of whether ejaculation happens with a partner or alone. Too many men, particularly widowers or men going through a divorce later in life, quietly write off this entire area of their health because they've equated it exclusively with partnered activity. That's simply not how the physiology works, and clinging to that assumption means missing out on real, measurable health benefits for years at a stretch. The third misunderstanding, and one I hear constantly, is a kind of quiet embarrassment. A sense that this isn't something a man in his 60s or 70s should still be thinking about, as if there's an unspoken age where it becomes inappropriate to care. I want to be direct about this. There is no such age. The studies I mentioned earlier tracked men well into their 70s and beyond, and the associations with prostate health and stress reduction didn't disappear simply because the men in the studies were older. If anything, the research suggests this becomes more relevant with age, not less, precisely because prostate cancer risk itself climbs steadily in these same decades. Here's something that frustrates me professionally. Surveys of primary care visits consistently show that this entire topic gets raised in only a small fraction of appointments involving older men, despite how frequently it's actually relevant to their health. Part of the blame sits with physicians, many of whom simply don't bring it up unless a patient does first, treating it as outside the scope of a standard checkup. But part of it sits with patients too, who often decide in advance that they won't mention it, assuming their doctor will think it's inappropriate, irrelevant, or embarrassing to discuss at their age. I try to bring it up proactively with my older male patients for exactly this reason, because I've seen how much relief there is when someone finally says it out loud in a clinical, matter-of-fact way. Men who've been quietly worried about a decline for years, wondering if it means something is wrong with them, often just need permission to talk about it plainly, and a clear explanation of what's normal, what's worth addressing, and what's simply part of a natural pattern that isn't dangerous or hormonal in nature at all. If your own doctor has never brought this up, that doesn't mean it isn't worth discussing. It usually just means the appointment never allowed enough time, or nobody wanted to be the one to open the door. You're allowed to be the one who opens it. In my experience, most doctors respond to this kind of direct question with relief rather than discomfort, because it gives them a clear entry point into a conversation they often wanted to have anyway. Bringing all of this together, here's what I'd actually suggest in practical terms for men reading this and wondering what to do with it. First, don't treat a noticeable decline as something to simply accept without question. If frequency has dropped off significantly and you can't attribute it to an obvious lifestyle change, mention it at your next physical. It could be medication-related, hormone-related, or simply something worth monitoring, but you won't know until you ask. Second, don't equate this entire area of health exclusively with partnered activity. If you're single, widowed, or in a relationship where frequency has changed for reasons outside your control, the health benefits we've discussed don't require a partner to access. Third, treat consistency as more important than any specific number. The research doesn't suggest you need to hit a precise target. It suggests that long stretches of complete absence, particularly as you move into your 60s and 70s, are where the more meaningful differences in outcomes tend to show up. And finally, don't let embarrassment be the reason you avoid a conversation, whether that's with your doctor, your partner, or simply with yourself about whether this is an area of your health you've been neglecting. Every other system we've discussed on this channel, sleep, movement, stress, connection, ties back into overall longevity and quality of life. This is no different. It deserves the same honest, unembarrassed attention as everything else on that list, and the men who give it that attention tend to be better off for it. So if you're older and it's been a while, the takeaway from the research isn't complicated. Don't treat this as some separate, awkward category outside of health. It's connected to prostate health, to hormone regulation, to stress, to sleep, to mood. All the same systems we've talked about in previous videos tie back into this one, quietly overlooked piece. You don't need a specific number to chase. You don't need to overthink it. You just need to stop treating it as optional. The same way you shouldn't treat movement, sleep, or nutrition as optional once you're past 60. If this conversation was useful or overdue, let me know in the comments. This is exactly the kind of topic that stays hidden because nobody's willing to say it plainly, and I'd rather say it plainly than let another generation of men find out too late that this mattered more than they thought. Subscribe if you want more honest, direct conversations like this one. I'll see you in the next video.